Located in southern Africa, Malawi is a landlocked country sharing its borders with Mozambique, Zambia, and Tanzania. According to the 2018 Malawi Population and Housing Census, the country has an estimated population of 17,563,749 people. Poverty and unemployment remain high in the country. Many young girls and women tend to sex work to support themselves and their families. While the country has made huge strides in fighting the HIV/AIDS pandemic, sex workers remain extremely exposed to the disease. Key populations, including female sex workers, have lower access to health information and health care than others in the community. Sex workers are over 5 times more likely to contract HIV. They also face much higher risks of unwanted pregnancies and sexually transmitted infections, STIs. Globally, 20.9 million people are receiving antiretroviral treatment, ART, with several countries on track to reach the 90-90-90 targets by 2020. Despite this progress, certain populations are being left behind. Globally, HIV prevalence among female sex workers is 12 and 19 times higher, respectively, than in the general population. It is against this background that a project called Linking Female Sex Workers to Services was introduced. Family Planning Association of Malawi, FIPAM, with support from Global Fund through Action Aid, which is a principal recipient for the grant, has been implementing the project in 2 phases. The first phase was implemented from 2016 to 2017, and second phase has been implemented from 2018 to 2020. The project is being implemented in 11 districts, where FIPAM, as a sub-recipient, directly implements in Karonga, Kasungu, Mchinji, Salima, Dowa, Dedza, and Chewu districts, and Pakajere IHD, which is a sub-recipient, implements in Ngatabe, Nkhotakota, Chiolo, and Mulanje. The project aims to increase an effective response to prevent and mitigate HIV and AIDS through innovative efforts for improving access to and uptake of HIV services to key populations. This is Salima, one of the districts where the project is being implemented. Community reproductive health promoter who leads the project in the district, Rector Banaba, says through the project, sex workers in Salima have been linked to services.
This project, we are linking the sex workers to health services. Basically, we are giving them information and even the service delivery, whereby we are trying to make them know their rights and even where they can get the services nearest health facility.
Ntchito ya sex workers ninayamba 1977 ku Lilongwe, ndipo ndimakhalira mu Mchesi. Nachichoka ku Mchesi kubwera kunoko 1988 tinabwera pa Chipoka pano, ndipo ndimakhala ndi mayi anga. Ndebe ngakhale ndinabwera kunoko, ntchito yanga sindinayisiyayi, ndimapitirizabe kupanga uhule wanga. Kale ndimati uhule, ma sex workers ndi chizungu chimene ndimapanga uhule. Lero upanga uhule ucha kuchoka 1988 kufikira na pano ine sex workers ibe. Ndiye kupese kuonena kuti tili mkati moyenda basi kufikira na kuti akamuzi aja nkumatisiya nkubwera matipate wengakhala analowa koma ifeyo mahule tinkakumana ndi zinthu zokoma. Makamaka kumbali ya polisi ankatigwira vakabu, kumatigona kumene, kumati tidzipulumutse. Ngati ulibe ndalama yopereka amati kumapita nawe pa khoti mpaka so kumatani kumatimanga, monga ndinamangidwapo kawiri. Prison ya Kuzomba ndinakakhalapo chifukwa cha sex workers. Prison ya Kumaula ndinakhalapo chifukwa cha sex workers, kutigwira vakapo. ndiye kuchokera pamene popo titafika chaka chino cha 3 ndikugwira ntchito ndi bungwe la FIPA mwitabwera kuzani ligwira nafe ntchito ma sex workers pamene ifeyo ma sex workers tinapeza ufulu ndi maudindo pamene poyamba apo sitimadziwa china chilichonse ayi timangokhala.
Having noted such challenges, police officers were also trained on how they can work with female sex workers. In Nchewu District, Community Policing and Victim Support Unit Coordinator Inspector Wile Bunya says the police in Nchewu have been receiving many cases of gender-based violence among sex workers. He says because of the project, many female sex workers now know their rights.
For the past 2-3 months, we have been receiving cases of gender-based violence whereby perpetrators are their customers.
The clinic that is taken to the sex workers while at their workplace is called Moonlight. Frederick Monjeza says considering that female sex workers work during the night, it becomes hard for them to go to the hospital during the day. As such, it is critical to find them where they are based with services.
According to their business, they do play their business at night. So if they want to go to the clinic, it's during the day. So during daytime is their time to sleep.
Sex workers normally do their business at night. Bar owners also have a role to play. Benson Zulu is a rest house owner in Mchinji, and he testifies the benefits of the project.
Pindu nikuipeza chifukwa sinikupeza asikana odwala pafupi kapena onipasa mavuto osiyanasiyana kuti wina watenga matenda pano ndi akulimbana ndi msikana wa pano chifukwa choti achipatala amabwera amayesa ndipo akapeza ndi mavuto amasogolera zopita kuchipatala kuti azikalandira chithandizo. Komanso zishango zija zimene amasiya zija zimathandizira kwambiri moti business yathu ipita pasogolo chifukwa choti munthu akabwera ochoka kubwalo kuti achize nasikana sana mizira boza kuti palibe chishango chifukwa chishango amachipeza.
nakathandizika ndikuti namasuka tumilato ndinti matose ndathandizanza tusona pembali malike kuno wauza mosadandaula kunota HIV panopo tiona kuti sekitoti tikachoka kwezi kuona naye pano kuena kuti ndidzete izo mbali ya HIV.
So basically we do the female sex work project where we reach out to the female sex workers, providing them with services like HIV testing and counseling, provision of family planning services methods, provision of cervical cancer screening, sexual transmitted infection screening, and GBV screening, and also provision of male and female condoms and also lubricants for the female sex workers. Basically, we do provide these services every month, and it depends with the hotspots. Sometimes we reach out to up to 20 female sex workers in the hotspot. Some other hotspots can reach out to even 30, 40 female sex workers.
Sex workers are 5.4 times more at risk of HIV infection than their female counterparts in the general population. This estimate is based on the total prevalence among women aged 15 to 49 years in the general population in Malawi. Female sex workers can now afford a smile as they are now doing their business with easy access to health services and are now healthy. They are only hopeful that organizations such as FIPAM will continue supporting them.